Please go ahead and put any questions that you have in the chat, and we will have some time at the end, we hope, to address your questions. And with that, we can start the recording. All right. Thanks again to San Jose School of Information for having us. And with that, hi, I'm Bethany Ross. I'm a public services librarian with Plano Public Library. I've been with the library for almost 5 years, and prior to that, I worked at the Women's Collection at Texas Women's University. Here at Plano, many of the programs and services that I've worked on have focused on older adults.
Hi, I'm Brent Bloechle. I'm the manager at the Meredith M. Davis Library in Plano. I've been with the library for 17 years and the manager at the Davis Library for 12. I focus on staff development, and this for about 1.5 years now, I'm going to be focusing on remodeling and expanding the entire library here, and we're moving into an additional building also. So that's, and we're staying open. So that's keeping me very busy.
All right. So just to go over our agenda, today we will be talking about our senior care call service, which connected Plano Library staff with the most isolated population in the community during the first year of COVID-19. Seniors are a focus for Plano Public Library, but our service model can be adapted for other populations or types of services. So be thinking, how can you adapt this concept to the needs of your library community? Today we'll be talking about understanding the need. We'll talk about how the idea for this service came about, developing the service. We'll talk about the steps that we took to develop this service. Connecting with the community, we'll talk about how the city of Plano worked to promote the service to the community. Common goals and challenges. We'll cover the challenges and goals that we face that are common to service and program development and implementation at most libraries. And for outcomes and opportunities, we'll end by reviewing the outcomes of the service and the opportunities that have arisen from it.
Understanding the need. As I'm sure you can all remember, we're changing our service model almost every day at the beginning of the pandemic. And as you can see on the slide, we had some very quick changes that we in Plano addressed. With the canceling of classes, the closing of library locations, switching to porch pickup, and then turning everything off and sending staff home. We were closed for 8 weeks, and during that time period, we did not lay any staff off. During that time period, we took the opportunity to evaluate our services and what we could do to support the community in this very challenging time. One of those services was senior care calls, and that was staffed by librarians and our library services representative. Basically, all the staff in the building could participate. We had the librarians took over the city of Plano's COVID call center, and we were the routing service and question answerers for the entire city as the calls came in. We developed a senior social connections page to help seniors that were isolated at home connect with others across the community to maintain their connections. We developed a board that the city publicized across the city of senior specific services and business hours related to those services. That was where we went, and that's how we changed. And during that time period, we also started virtual programming and story times. We supported the city by having staff that were at home go out. We did park monitoring. At that time, we were going out into the parks actually and encouraging people not to congregate closely in large groups. And then we also had staff develop in a very short period of time while we were closed, over 600 hours of online training that they could do at home while they were isolated during the beginning parts of the pandemic. Some was new training and some was materials that we reimagined as virtual training. As you can see, here's our Check It Out program, and this is how we changed our services and the services that we provided during that time period and what we promoted.
So developing the service. the origin of senior care calls. The city of Plano was concerned about some of the most vulnerable in our community when the stay-at-home order was initiated in March 2020. At the end of March 2020, the City of Plano's Communication and Media Relations Department asked the library to explore and create a program to connect with seniors. One library manager and 2 senior librarians collaborated to create a program that provided regularly scheduled bi-weekly telephone calls to homebound or isolated seniors during the stay-at-home period. And pictured here is a press release that went out from the mayor in March, saying, advising people to stay home to be safe.
So on the fly, the program was developed basically the end of March, and by the very middle part of April, the service was up and running. During that 3-week time period, we created a training manual and supporting documents to help staff to create scripts and how to talk to complete strangers over the phone, what topics to cover, what topics not to cover, and how to explain what the service provided. In less than 3 weeks from the imagining of the idea to the conception of the item or the program, it was implemented and the city began to promote it through the various means that they have, which would be the SAGE newsletter, which is our senior services newsletter, news releases, and the City of Plano website. We encourage you to think about this if you're considering it, to how do you develop relationships with other departments, city and local governments, as well as local organizations. This is what it took for us to get this program going and our other numerous programs that we implemented to support our seniors during this time period. It was beyond our normal scope of activities, but we reached out into the community, we expanded our reach across the city, and this made the program successful.
So there are seniors in your community who would love a friendly call. How can you get started? Or what other service or program do you want to develop for your unique community? So establish a plan with clear standards. Connect with stakeholders within and outside your organization. Contact library staff members who are interested in being involved, and meet with staff from other city departments. Call local nonprofits and government agencies who serve your community. Identify staff and recruit them to your call team. Provide staff with a description about your prospective service or program and the target audience. Be specific in defining the skills you will need on the team, and ask staff with those skill sets to join the team. Develop a staff training and guidelines. A training guide, sample language and scripts, and a call log were the tools that helped our staff succeed with senior care calls. These tools prepared them for that first call, for subsequent calls over the weeks and months that followed, and it allowed us as a team to develop the service in real time. Prepare for contingencies. Plan to scale your program or service up or down as needed. Be ready for unexpected questions or discoveries. Promote the service within the community. Lean on your existing methods of promotion to get the word out about your new program or service. Share it with staff in an email and talk it up in staff meetings. Invite stakeholders to attend a program, and let people in your organization know when you have successes.
So what were we looking for when we started recruiting staff to participate in this program? We had one very specific criteria that we looked for, and that was the ability to have a casual conversation with a total and complete stranger. At the Plano Public Library, our expectation is that the staff provide one-to-one service and to take the time to chat with patrons and listen to them. We view this conversation with patrons, and especially with seniors, as part of our library services. The transition from this level of service to making calls and having a conversation was an extension of the service levels that we have always expected and we've encouraged staff to demonstrate in the building. Each staff member call was between 1 and 6 seniors during this time period, every other week for up to 10 minutes. As friendships developed, we discovered that 10-minute limit was generally not followed. Many people, as they developed those friendships, the conversations extended to 30 minutes and sometimes longer. This program was not just with the Plano Public Library System. This is a citywide activity, generally led by the Plano Public Library, but we also reached out and we had staff support from the Plano Event Center and also from the Sam Johnson Senior Recreation Center. At the height of the service, we had 33 staff members participating from the Plano Public Library at the Plano Center and the Sam Johnson Recreation Center. They were calling over 100 seniors per week, and the team members were available to speak in Spanish, Chinese, Tagalog, and Swedish to help reach Plano's diverse communities. When starting the program in your community, please consider the talents and skills of your staff and how you can match up those strengths with what the community's needs are. Pictured is one of our staff members making a senior care call, Holly, was kind of our focus person who became the picture of the service on many of our media interviews that we did.
When embarking on a new library program or service, keep these core questions in mind. Participants, who are you serving? Our target population was people in the community who were isolated for various reasons, for COVID, for other health issues, for mobility issues. Motivation, why are they interested in participating? So why did people sign up for senior care calls? They were sheltering at home, alone, and they needed an outlet to voice their concerns and share their experiences during the pandemic. Even those who were living with families signed up. People wanted to tell their stories to a sympathetic ear, and sometimes that meant talking to someone outside of home. Rewards, how does the service help? For those we call, the interaction with staff reaffirms their value as a person and as a member of our community. For staff, it has meant rewarding work that has an immediate outcome. Our seniors tell us how much they enjoy receiving the calls. For everyone, senior care calls has resulted in positive relationships that have lasted over 1.5 years. It has demonstrated to our community the ways that the library and the city work together to support seniors. And pictured here is an article about senior care calls that appeared in Community Impact, which is a local news magazine.
At the onset of the pandemic, many of the seniors that we worked with had needs beyond a friendly conversation and a voice to chat with. The staff worked with the City of Plano to utilize the senior resources that the city provided, and the librarian staff developed a list of resources that we could refer people to across the community. We worked with Plano Citizens Police Academy Alumni Association to get free grocery delivery to seniors. We worked with those that had food insecurities with 2 of our community food banks. Those that were having issues with their mental health, we had a variety of community services and state services that we could refer them to. We provided hours for specific senior service hours that they could go shopping where there was limited access to grocery stores and pharmacies, and several different transportation services to help people get to their medical appointments during this time period. Developing partnerships was one of our greatest challenges and opportunities during this time period. We had great open communication. We found people that we didn't know existed that were providing services during this time period, as many people across and organizations across the community stepped forward to help people in the community, and especially our seniors. I would encourage you that if you consider a program like this, see which organizations within your community you can partner with and have somebody specifically designated to work with them.
Some of the challenges that we've overcome or faced in developing this service are common ones for libraries. Challenges with communication, technology, and staffing. Promoting the service to English language learner communities. Early on, one of our Spanish-speaking librarians was interviewed about the program by Univision, the Spanish language television network. They asked how we were promoting the service to our Spanish-speaking community. We took this question to the city's communication department, and plans were made to have the survey available in Spanish. Still, there is a lot of work to be done finding ways to connect with our immigrant communities. Providing technology to staff. Finding ways that staff can make calls from City of Plano phone numbers has been a challenge. In our communication system, not all of our staff have dedicated phone lines. Those staff members must use phones in the building. Also, it's important for staff to have access to quiet, private spaces to conduct these calls. Sometimes this is difficult depending on the time of day and the number of in-person and virtual programs going on in a building. Finally, having adequate staff to support the program. When the service debuted, most staff members were telecommuting and had both time and space during their day to devote to making calls. There has been turnover with staff for various reasons. Some of our original senior care call staff no longer work for the City of Plano. Others have found their main work responsibilities are starting to take priority. And some have had a change of work status and are unable to continue making calls.
There were challenges with senior care calls. It was learning as we go as we started the program and rolled it out to the community. And this service development was worked from the ground up. We adapted the service to meet the needs of the seniors and the staff. One of the most challenging was addressing difficult conversations with seniors. We encouraged staff to set parameters with their seniors from the outset, defining the calls as friendly chats by establishing a biweekly time frame for calls and the duration for the calls, not more than 30 minutes. We had to develop a course of action for what to do about people who wanted to receive calls, but who were not nice to speak with or were even abusive on the phone. After staff member let the team supervisors know about the difficult person the individual was communicated with, as were others, and in some instances, we shifted them to another person to make the calls. We did everything possible not to take somebody out of the program. The other side of that is the self-care for staff. Some of these calls can be very emotional. The public shared difficulties they had with their personal health and the problems that their families and friends were suffering through at this time also. To keep the staff from being overwhelmed by the emotional impact of the calls, we developed some tips for self-care. Taking breaks after calls, reaching out to the mentors for guidance, and sharing their experiences during team meetings. Some seniors wanted to receive a call every month, and other seniors needed a call every week. And we had a guideline, but we also learned that we needed to adapt. If you consider this problem or this program, meet with your staff periodically to get their feedback, service processes and staff and patron issues. Maintain open lines of communication so that your staff has somebody to call, somebody to lean on, and somebody to share frustrations and successes with. Provide an opportunity to celebrate great stories. This will keep staff motivated and energized. And be open to change, because as with many things, you can have great plans, and the great plans, when implemented, don't always work. One aspect of the program that we were completely unprepared for was the media response. From one article in a local newspaper, the media attention grew. This may have been that we were a positive message in a time when most of the news was gloomy. One senior that was interviewed by AP had the time of her life tracking her story across the world. She's pictured in the next slide. Dell was a wonderful person to talk with and a great interview. She tracked this article from AP to over 1,500 media outlets, and including New Zealand and Taiwan. And due to the media attention, we were receiving calls from people across the country wanting to participate, where they saw about the program in their own newspaper or heard about it on their local radio station. We also had cities and libraries from across the country reach out to us about information about the program. And we shared our guidelines, our training manual, and other information that we had. The news organizations that we showed up in were the New York Times, Associated Press, Univision, and one of my favorites was our local KRLD news radio station, which covers all of North Texas. The Plano Public Library librarians were named the difference makers of the week in early spring. So if you take a program like this or something similar, You never know when you may hit that nerve within the community that makes you very popular and have many people wanting to talk to you. So be prepared to describe the service, have somebody who's comfortable speaking, who likes to be interviewed and on camera, and communicate the needs to the community, what your core service is, share the positive experiences with both the staff and how the community has engaged with the program.
And this is a picture of Dell, who charted the course of that AP story. And she was a wonderful person who received senior care calls. So conclusions, we've learned a lot from our experience developing this service. The community response, we've had positive feedback from participants. The value of the library and partners has spread beyond the city to nearby communities. And we have had people from cities, again, from all over the country contacting us. And it achieved the goal of connecting with isolated seniors. Staff impact. Staff received support and encouragement from participants, and staff experienced the value of developing and delivering a unique service, and they became more aware of community needs and interests. And it enabled staff to build relationships outside of their library location, beyond the library even. So that was really fantastic for staff. And we did have acknowledgement from city leadership. Our mayor included senior care calls as an example of the city's commitment to community during his State of the City address. As needs have changed in the fall of 2021, we are in the process of assessing senior care call service, and we're looking to use what we've learned to more fully engage with our senior community. So improve city services to seniors. What we've learned from our seniors and their needs during this pandemic has and will continue to drive new services and programs for them. And volunteer opportunity, we've already started a conversation with the volunteers in Plano, the city department, to see how we can engage the city's many wonderful and dedicated volunteers to support seniors in the community. Time and again, team members have said that they really enjoy the relationships that have developed with seniors they call. These calls provide a sense of purpose for both our team members and those they call. So what service awaits your library to connect people with each other and with important, even vital resources to help them remain healthy and resilient? To end our presentation, I'd like to share with you something one of our staff members had to say about the experience of senior care calls. For me, the senior care call program is about truly connecting and building relationships with people in our community. It brightens up my day when I get to hear a funny story that one of my callers shares, and we both get a chuckle out of it. I know it makes a difference in another person's life when I make a call, but it has also enriched my own life knowing I have made a difference. And I'm going to, with that, we will answer questions. Please email us if you have any questions. And this slide deck will be available on the conference website. Let's see.
So it looks like we have 4 questions, Bethany. The first is from Megan Summers. She's an adult, part-time adult services librarian in suburban Detroit, and she has very little time for outreach. Do you have any tips for implementing this kind of service with time constraints?
With time constraints. I'm off the top of my head, I'm not sure. I'll have to think about that. I'm so sorry. Maybe Brent might have some questions, but Megan, I'd be glad to think about it and get back to you via email.
So I'll kind of address the volunteer. There are several questions related to volunteers. When we initiated this program, we did not reach out to volunteers to do it because at that time we did have some issues related to, because of the stress people were under related to the pandemic, that were not positive calls. And we were able, the city of Plano is able to manage the phone numbers so that people, we didn't let people use their personal phones. Everybody that made calls had to use a city of Plano phone number so that people would not get attached to them on their personal phone number. And the concern we had, we did not have a way for volunteers at that time to access city phones and keep their personal connection away from the people they were calling. So we are working with a community-based organization now that believes they figured out a way to do that. And we will be working with that volunteer organization to continue expanding the program. So, but yes, it's a challenge, and the city of Plano has a robust volunteer program where they do vet people. And we have, I think it's over 7,000 volunteers across the city last year. So volunteers are a possibility, and we're looking that direction.
And Cecilia asked about handling calls from seniors nationwide. If people reach out to us, we return the call. We decided that it was a moment in time where we weren't going to contain our service to Collin County or to Plano or North Texas. And yes, if people signed up, we called them.
Yeah, we have people in, I believe, Ohio and Pennsylvania that we talked to, and some other cities, but those are the first that come to mind.
Yes, I mean, as far as someone asked about letting patrons know the scope limit of your service, and it kind of taught, also someone asked about patron needs. So in our guidelines to staff, we were very clear about the kind of information, you know, they couldn't give medical advice, financial advice, things that normally library staff don't provide, but we could refer them to vetted sources. And so that is a lot of what we did as well. We had, we maintained a list of good referrals and connected people in that way with the services that they needed that the library doesn't provide. Let's see. Volunteer coordinator. I think if possible, it would be great to involve volunteers, but a big concern is privacy. Oops. Sorry, I don't know if we're going to be able to answer all the questions before the end of this program.
And please feel free, we have our email addresses on the screen right now. Please feel free to email us. We are used to getting emails regarding this program. And if you'd like any information, we're more than happy to respond to your questions.
Someone asked about privacy issues with people receiving calls, and they signed up. So when we called them initially, we said, hi, you signed up for this senior care call service. Do you want to receive it? So we tried to make sure that they understood why they were receiving the call, and that they knew that they were receiving calls from City of Plano staff, and that they could opt out at any time.
That was a good message too, because we had numerous times where the children of the seniors had signed the senior up. And in some instances, the senior didn't know that their children had signed them up.
So again, I think we are reaching the end of our time. If we did not answer your question from the chat, please do email us and we will get back to you. And thanks again for joining us today. It's been a pleasure.
Thank you. Have a great afternoon.